daily press conference with people that you already know and that you've been following for some time. And of course, Dr. Theresa Tam will be there we'll be talking about the daily update. And of course, the Deputy Chief Health Administrator, also, Dr. New, will also be there to provide some remarks. Donc, Theresa Tam et Dr. New vont être là.
Dr. Theresa Tam and Dr. New will be here to answer your questions and provide, of course, an update. And my colleague Mark Miller and I are here for further announcements as well. Today's subject, we also have Jeremy to support the conference. Thank you.
Everyone, bonjour. There are now 97,125 confirmed cases of COVID-19, including 7,960 deaths and 56,639, or 58% of cases have now recovered. Labs across Canada have tested over 1,989,000 people for COVID-19 to date. Over the past week, we have been testing an average of 33,000 people daily, with 2% of these testing positive. These numbers change quickly and are now being updated once daily in the evenings on canada.ca/coronavirus. After months of Canadians working together to flatten the curve and protect our health system, provinces and territories have been able to resume some important medical procedures like elective surgeries. So for parents, children, and adults of all ages who have been anxiously waiting out the weeks and months of COVID-19, not being able to schedule surgeries for a whole range of medical issues has only added to their pain and discomfort. Resuming these important medical procedures has been a top priority of reopening plans, but there is another challenge to address. Earlier, I talked about the ongoing needs to continue donating blood. I asked blood donors to book and keep their appointments to help prevent shortages, and Canadians rose to the call. It is thanks to Canadians continuing to donate throughout the COVID-19 crisis that Canadian Blood Services and Quebec have been able to keep up with demand for medical emergencies. However, as elective procedures have now resumed, there is a growing need for blood donations to restore and maintain critical inventory. So I am asking Canadians once again to roll up their sleeves and help out. Canadian Blood Services and Quebec have enhanced measures in place, including robust cleaning, infection control, and screening practices to protect all donors, staff, and volunteers. Physical distancing measures are in place at all blood donor clinics, including by appointment-only visits to limit the number of people within clinics and spacing or screener of donor beds. Wearing of masks is mandatory for all staff and volunteers, and all donors are pre-screened when they book their appointments and screened again on arrival. This week, from June 8th to the 14th, is National Blood Donor Week, when we recognize the essential role that donors play in strengthening Canada's lifeline. So it's a great week to schedule an appointment for your regular donation or sign up as a new donor to join the lifeline. Thank you. Merci.
Bonjour.
Good afternoon. There are now 97,125 confirmed cases of COVID-19, including 7,960 deaths and 56,639, or 58% now recovered. Labs across Canada have tested over 1,989,000 people for COVID-19 to date. Over the past week, we have been testing an average of 33,000 people daily, with 2% of these testing positive. These numbers change quickly and are now being updated once daily in the evenings on canada.ca/coronavirus. After months of Canadians working together to flatten the curve and protect our health system, provinces and territories have been able to resume important medical procedures like elective surgeries. So for parents, children, and adults of all ages who have been anxiously waiting out the weeks and months of COVID-19, not being able to schedule surgery for a whole range of medical issues has only added to their pain and discomfort. Resuming these important medical procedures has been a top priority of reopening plans, but there is another challenge to address. Earlier in the year, I talked about the ongoing need to continue donating blood. We asked blood donors to book and keep their appointments to help prevent shortages, and Canadians rose to the call. It is thanks to Canadians continuing to donate throughout the COVID-19 crisis that Canadian Blood Services and IMA Quebec have been able to keep up with demand for medical emergencies. However, as elective procedures have now resumed, there is a growing need for blood donations to restore and maintain critical inventory. So we are asking Canadians once again to roll up their sleeves and help out. Canadian Blood Services and IMA Quebec have enhanced measures in place, including robust cleaning, infection control, and screening practices to protect all donors, staff, and volunteers. Physical distancing measures are in place at all blood donor clinics, including by appointment only visits to limit the number of people within clinics, as well as spacing or screening of donor beds. This is mandatory for all staff and volunteers, and all donors are pre-screened when they book their appointment and screened again on arrival. This week, from June 8th to June 14th, is National Blood Donor Week, when we recognize the essential role that donors play in strengthening Canada's lifeline. So it is a great week to schedule an appointment for your regular donation or sign up as a new donor to join the lifeline. Thank you.
Merci beaucoup. Donc, passons maintenant à la...
Thank you very much. Our Minister for Indigenous Affairs, Mark Miller.
Acknowledge our presence on the traditional territory of Algonquin people. Kwe, Tanse, Sego, Ulukut, good afternoon, bonjour. We continue to see the COVID-19 curve flattening on First Nations reserves and in Nunavik. As of June 10th, there have been 237 confirmed cases of COVID-19 on First Nations reserves in provinces and 16 cases in Nunavik. The total of recovered cases stands at 207 for First Nations reserves and 16 in Nunavik. While these are positive developments, individuals need to remain vigilant in their personal measures to protect themselves, their families, and communities. In particular, as we see the gradual reopening of businesses, activities, and travel across the country, the risk of a resurgence of new infections is something we simply can't ignore. We're very mindful of this and will continue to work with Indigenous communities and partners as they respond to the health and social impacts of COVID-19. While our top priority remains the health and safety of individuals, I want to acknowledge the tough times Indigenous businesses and economies have faced as a result of the COVID-19 pandemic. There are more than 30,000 Indigenous businesses in Canada. These are places of pride, of strength, of growth for many communities. Most of these businesses are small to medium-sized enterprises and operated in sectors particularly hard hit by COVID-19. Due to their small size, they operate with low liquidity and face unique challenges in accessing private credit. We've announced both targeted and broad-based benefits to support businesses across this country in the hope that they can still have a business to reopen when the time comes. In response to the specific needs of Indigenous businesses, on April 18th, we announced $306.8 million in funding to small and medium-sized businesses that work within the network of Aboriginal financial institutions across Canada. This funding is providing interest-free loans and non-repayable contributions to small and medium-sized Indigenous businesses to address the immediate financial impacts of the pandemic. But we recognize that there are still gaps that need to be addressed to ensure that no Indigenous business, First Nation, Inuit, or Métis slips through the cracks. And that's why today I'm pleased to announce an additional $133 million in new support for Indigenous businesses. This new funding includes $16 million to support the Indigenous tourism industry through the Indigenous Tourism Association of Canada. This will help sustain and stabilize approximately 640 Indigenous tourism businesses by providing non-repayable grants of up to $25,000. As we transition into the summer months, the tourism sector will continue to feel the impact of this pandemic. It's particularly hard hit. And we want to support all that they do to show off some of the best that this country has to offer. Ce nouveau financement comprend 16 millions de dollars.
This new funding will help Indigenous tourism businesses weather COVID-19 by supporting businesses as they seek out new ways of operating in a changed world. 640 businesses will be receiving non-repayable grants of up to $225,000. As we transition into the summer months, the tourism sector will continue to feel the impact of this pandemic, and we want to support all that they do to show off some of the best that this country has to offer.
Will help Indigenous tourism businesses weather COVID-19 by supporting businesses as they seek out new ways of operating in a changed world. The Indigenous Tourism Association of Canada is already doing vital work to support the Indigenous tourism sector through these difficult times. This funding is expected to roll out in the coming weeks so that they can ramp up their work and support more Indigenous tourism operators from coast to coast to coast. We are also allocating $117 million to support Indigenous businesses with persisting needs and who may not be eligible for existing business support measures. We know that just like in all communities across Canada, Indigenous businesses are vital. They are vital to the economic health and development of communities. They are vital to the industrial sectors in which they operate, and they will play a vital role in Canada's recovery from this crisis. We want to make sure that they are still there on the other side of this pandemic. This funding will seek to meet needs. For example, communities could use this funding to assist micro-entrepreneurs, including home-based businesses and essential economic activities such as hunters and artisans who are ineligible for mainstream measures. Funding could be used for various activities such as community economic development services, capacity building, planning, and retrofitting of businesses for reopening. More information on the rollout of these measures will be available in due course. We will also continue to engage with other government departments, provincial and territorial governments, as well as Indigenous leadership to ensure that we fill gaps, meet ongoing needs, and hopefully position all sectors of this economy so that they are able to make a full recovery. Le soutien des peuples autochtones au Canada.
Supporting Indigenous peoples in Canada is a shared responsibility between all federal ministries, provincial, territorial, and Indigenous partners. Advancing reconciliation means changing colonial laws, policies, and practices and addressing their impacts on the lives of Indigenous peoples. I'm committed to build a renewed relationship based on recognition of these rights, respect, cooperation, and partnership, and to ensure Indigenous communities receive the care and support they need when they need it.
Ahead with cautious optimism, I want to ensure everyone that our priority remains supporting Indigenous leaders as they work to protect the health, safety, and prosperity of communities. Miigwech, Marcy Cho, Nakomik, thank you. Merci à tous.
Merci, Marc. En effet, des bonnes nouvelles.
Thank you, Mark. That is good news indeed. Good news because we know that the tourism sector has been hard hit, specifically the Indigenous tourism sector. And that's why we've taken a number of measures to support businesses, specifically Indigenous businesses, keep their employees on the payroll.
Has been hard hit by the pandemic and the economic crisis. Just before the beginning of the pandemic, we were looking at, again, record-breaking years, another record-breaking year, and the sector was growing by 3.5% per year. And of the tourism sector, the sector that was even most growing the most was actually Indigenous tourism. And so the reality is also that many of these Indigenous tourism business are new and therefore more vulnerable. And that's why I wanted to commend my colleague for this new funding of $16 million. This has been an ask on the part of the Indigenous Tourism Association of Canada and his president, Keith Henry, and I'm convinced they will be delighted because definitely businesses, and we need to make sure that we're able to help them survive this pandemic, this economic crisis, and meet them on the other side of the bridge when this is over. So let's now take questions. Et à toi, Jérémy.
Merci, Madame la Ministre. C'est ce qui commence la conférence de presse.
Thank you, Minister.
You that we stick to one question, one follow-up, and we'll start to the phone, please. Operator.
Merci. Thank you. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. The first question is from Lee Bertium from the Canadian Press. Please go ahead.
Yes, thank you. This question is for Dr. Tam. Many people are calling for an end to the blood donation ban on men who have sex with men and trans women. What is the scientific reason for this ban still existing, and why is Canada still banning this practice when many other countries have lifted their bans?
Yes, thank you for the question. I think there needs to be an ongoing examination of science as well as policy on this front, and absolutely we need to continue to look at this policy.
Thank you. Follow-up.
And with hindsight, do you regret telling people not to wear masks initially? And was that advice really grounded in public health expertise or in fears that there would not be enough masks for the frontline people if people ran out to buy them?
I think with a novel coronavirus, we're always learning more and more about the virus itself. I think since the beginning, we've always asked people to cover the coughs or put a mask over someone who is sick. And around, as the science evolved, it became more evident that pre-symptomatic people who haven't yet developed symptoms but is about to, and asymptomatic people can transmit this virus. So with the evolving science, the recommendation evolved. And so together with the other chief medical officer of health, we re-examined the science at the time and recommended the use of non-medical masks or facial coverings for the general public in settings where you can't keep the 2-meter physical distancing. We were very careful to remind Canadians that this is just one additional layer of protection, and it does not substitute for the core fundamental public health measures, including the physical distancing, staying home if you're sick, hand washing, and all the other measures, and that you have in terms of what the transmission of the virus is like in your community. So, so listen to your local public health from the perspective of what you need to do. But science continues to evolve, and we will continue to examine the recommendations on non-medical mask use of facial covering. I'm sure we may not see the end of our recommendations, and we need to keep an open mind on this.
Thank you, Doctor.
Dr. New, I would just add to what Dr. Tam has said is that, Canada is not alone. Certainly, as the science has evolved, it's countries around the world exchanging their experiencing and what's happened. And so certainly the sort of the evolution in terms of the recommendation in terms of the use of facial coverings has not been sort of unique to Canada. Look what's happening in the United States and Europe and other countries. So certainly Dr. Tam, in terms of what she said, it's been consistent with how the science has evolved and also what's been happening throughout the world. Thank you.
Thank you, doctors. We'll go for one last question on the phone.
Thank you. The next question is from Sharon Kirky from National Post. Please go ahead.
Hi, thanks for taking my question. Dr. Tam, sort of following up on the face masks. The World Health Organization said this week that its infection prevention control network is discussing face shields. And a University of Iowa team recently reported sort of the benefits of face shields over face masks, and they're urging sort of their adoption. I'm wondering your thoughts about the benefits of face shields or even goggles with masks for the public to help curb COVID-19 spread. I mean, should we be concerned about our eyes?
Yes, so there's different concepts of protection that we're talking about. So when we're recommending the wearing of non-medical masks or face coverings, generally is to prevent the the transmission of infection from yourself to others. So it's protecting others from yourself. So we're protecting each other. If you're looking at vulnerable populations in particular, and you're trying to protect the individual, then it is important to cover your eyes, because that's one area of your body where the virus, if you happen, you happen to encounter right next to you and it lands in your eye, that is a potential risk. So wearing goggles or face shield can sort of increase a layer of protection for the protection of the individual. So I think it is something that can be considered for vulnerable populations in particular. So there are two different concepts for the general public: going about regular activities, stay home, you're sick. But if you're going out, wearing the non-medical mask is one layer of added protection, and in crowded places like public transit, etc. But that's a very good question. And if we want to protect, for example, the elderly themselves, then covering the eyes is an important concept.
Thank you.
Oh, and one follow-up, if I may. Recently, some doctors in Italy said SARS-CoV-2 circulating in Italy appears weaker, that it appears to be losing potency. Now, that claim has been criticized by others, but I'm wondering, what are we seeing here in Canada in terms of transmissibility and in terms of severity? Is there any sign that SARS-CoV-2 is changing, the SARS-CoV-2 circulating here? And could moving closer to the summer potentially lead to decreased virus activity?
There are a lot of different concepts in your question. Let me just try and unpack that. So from the perspective of the genetics of the virus itself, the global scientific community does not believe there are different strains that may have changed the transmission or virulence of the virus. So that's one aspect of the data. But again, you need to keep looking at that. It's not just the genetic evolution, but you actually have to have supporting epidemiologic and clinical evidence about whether certain strains are related to increased transmissibility or virulence, or that there may be lab experiments, but there's no evidence from that front as yet. In terms of virulence, this virus is a serious public health issue. It continues to be extremely virulent, particularly for the different vulnerable populations, such as the elderly, people with underlying medical condition, and occasionally also causes very severe illness in younger age groups as well. So that hasn't changed in terms of epidemiology, but certainly we need to watch that carefully. It is still a very serious public health issue. In terms of transmissibility, again, the virus, evolution of the science is there, but no, absolutely, this virus is transmissible. That is how we need to look at it and need to go about our daily public health measures with the recognition that this virus is still a very transmissible illness, and continue our public health measures.
It's Dr. New, just to add to what Dr. Tam has said with respect to the question or issue about in the summer months, whether we can anticipate the virus, increasing or decreasing in terms of spread. There's two aspects to it. Certainly, from some of the evidence and experiences around the world, we're seeing that the virus is much more transmissible in enclosed spaces. So actually going outdoors with the nice weather with our summer, that's a good thing. And certainly we encourage people to go outdoors. On the other hand, though, unfortunately, is that some people going outdoors may then start to think that they can relax all of the good public health measures, the personal measures they should be taking with respect to physical distancing, et cetera. So it's a double-edged sword. Certainly going outside would, in general, decrease your risk, but you have to be careful and maintain all of those good public health measures, the physical distancing, the hand hygiene, et cetera. Otherwise, you'll just sort of negate the effect of being outside. Thank you.
Thank you, doctors. We'll now go to the room. Molly.
Hi, doctors and ministers. Thanks for taking time. Molly Thomas, CTV National News. The Prime Minister this morning spoke very clearly that systemic racism exists in every institution, including the federal government. And so I'm wondering, Minister Jolie and Minister Miller, if you have any examples of what you've seen in this building, what you've seen in your offices, what you've seen in the party of systemic racism.
Molly, look, that is an excellent question, Molly, and you know, as a party that is has stated and wants to be and has taken significant measures to be progressive, we have our own mistakes in the party. Luckily, we have pretty much an incredibly diverse group of people that have stood up and said they want to represent their fellow Canadians. Now, they don't only represent their identity, they represent all the Canadians in their constituency. I, for example, joined Black Caucus to represent and to be able to speak more intelligently about the situation of the English Black community. My riding represents, I represent Little Burgundy. It has been an eye-opening experience, and more often than not, my place is not to talk, but to listen. Some of the experiences that I hear from colleagues, the experiences I learned from Selena Caesar Chavan, from Greg Fergus, from Emmanuel, from Bardish. They've altered my way of thinking and had me re-examine a lot of views that I had, and I think Melanie would say the same. They exist within the institutions. We've had instances within the House where people have been judged based on the color of their skin. We have a lot of work to do. And there is no institution in government that is immune by some magical stroke of fate from systemic racism. We are not saying that everyone in society is racist. We have, yes, unconscious bias, but systemic institutions that have been put in place and are creating outcomes that are unfair. You can't not look at systemic racism as you cannot look at the institutionalization of incarceration, of the overrepresentation of Black and Indigenous peoples in the penal system, and not have to re-examine systemic racism. You can't look at the underemployment of people of color in the civil service, provincial, federal, territorial, and not have to re-examine systemic bias. We've introduced measures to anonymize application process. You should never be in a position where you have to anonymize, but the reality is people were not being selected based on their name looking a certain way, and it didn't read Mark Miller, I can tell you that much. So we have to keep fighting, and recognizing that is not a sign of weakness. I think it's a sign of maturity as a country. I think that we are at our best when we question ourselves, when we question when we question our instincts. And I think that's something that needs to be done, because I know we're turning around the issue, but it needs to be examined in the RCMP, and there's no question about it. Thank you.
Thank you, Molly. That's a very good question. I support what Mark just said regarding our colleagues, learning from them. We've learned from our staff also. And in my former work as a Canadian Heritage Minister, I was also in charge of multiculturalism. And I had the chance to meet many communities all across the country. And, you know, even before the events that are happening now, these discussions were happening, and many people were referencing to the fact that they had been discriminated, or that they were going through different situations that made their opportunities harder to seize than others. And that's exactly also why we decided to act and invest more. And even in 2018, we came up with some new funding to support some different initiatives to counter racism. So I, as a minister, obviously I never went through myself systemic racism, but the first time I had to deal with the issue was when I had to defend the anti-Islamophobia motion, and that was 3 years ago. And at the time, we had really tough conversations. And it was tough also within the House, because we never had unanimous consent on this very important motion. So I think that this is a conversation that has, what is happening right now is extremely important, because I see that as the first event following the public health crisis that we went through. And some say that the world has changed since the pandemic. I think it is the case, and I think people want to have these conversations, and that's why we are willing to have these conversations, not only internally, but also with our colleagues and with Canadians, and we have to condemn systemic racism every time we see it.
Thanks, Ministers. My second question, Minister Miller, you mentioned the RCMP. The head of the RCMP is still struggling to admit that systemic racism is a part of the force. The Prime Minister, though, said today he still has confidence in the head, in Brenda Lucki, to lead this country. Why should First Nations people, the people you represent, trust the system if the system of police doesn't even affect them?
Well, I would just say that I as Minister of Indigenous Services, I would like to say that I serve Indigenous peoples. I don't represent them and I don't speak for them. We can't deny that there is systemic racism in all our institutions. And as I mentioned to you in the earlier response, it isn't by some magical stroke of fate that the RCMP would be immune to that. We know it exists, and we have to acknowledge it. I'm not going to judge the commissioner by a series of interviews that she gave yesterday. She has said in the past, however, in fact, almost 2 years to this date, when she spoke to the Murdered and Missing Indigenous Women's Commission, that as part of the apology of the RCMP, that she undertook to do better, and that the RCMP and the Indigenous peoples were entitled to the best there was of the RCMP. Now, I look at that was a promise 2 years ago. I look at the events of the last couple weeks. I look at an event that my colleague Mike McLeod from the Northwest Territories told me about, an officer who had a prior conviction of sexual misconduct being put in Fort Good Hope. And I ask myself, is that the best? Is that the absolute best? Because that was the promise that was made 2 years ago. We need to look at that, and we need to look no further than the report of that came out from the Murdered Missing Indigenous Women's Commission. It speaks loud and clear about the work that needs to be done. There's work to be done within communities to give them more police. We talk a lot about defunding, but perhaps this is a question about refunding. Putting forward, as Minister Blair mentioned yesterday, a legislative framework that allows Indigenous policing. I look at a number of communities where, as a percentage of the population compared to non-Indigenous peoples, there is an overrepresentation of people that is served in the armed forces, that is served in the RCMP and various regional police forces, yet they don't themselves have their own policing community. That's not on the RCMP, that's on government. And it's something that we need to move forward on. And we need to look no further than that report when we need to move on it. We have moved as interim measures. We continue to move on a number of the recommendations, but that's a very important one to move on to recognize, because if you want to encourage nationhood, self-determination, you allow people control and safety and security. And the direct repercussion of that is more women are safe. And so those are my reflections. There's work to be done in the short term. In the short term, we do not condone, and we need to punish bad behavior. We need to allow independent investigations to be truly independent and to move forward. We need to move in the medium term on ensuring that there's proper policing. People are observing their oaths, respecting them. They took an oath, and many of them are very proud to exercise that function on a day-to-day basis, serving Canadians and Indigenous peoples living in Canada. And on the long term, medium to long term, re-examining those institutions, constantly question the issues of systemic racism in institutions that hold exceptional powers of life and death. And with exceptional powers come exceptional responsibilities.
Thank you. We'll now go to Ashley Burke from CBC.
Minister Miller, is it a problem that the commissioner of the RCMP doesn't seem to know the definition of systemic racism? And what does that say about the organization?
As I said, I will not judge the commissioner on a series of interviews that she made. Yesterday, I I'll judge her on the promises that she made to Indigenous peoples when it comes to my portfolio. We must acknowledge, the government has acknowledged that there is institutional racism in Canada. The RCMP is not immune, nor is any organization. And that re-examination requires a tremendous amount of education and self-awareness, frankly. We need to listen to those voices who have experienced it. But I'm not someone that's experienced it, but I do listen. I question my instincts. We all make mistakes. And this isn't a question about indicting every single person and saying they are racist or this is systematically within the institution, every person is a racist. That is misunderstanding it. Senator Sinclair says that systemic racism is when you take away the overt racism. It's what's left over. It's the institutions that perpetuated it. It's the institutions that allowed it to thrive. And that's still there. We can't run away from that fact. And indeed, it's a sign of maturity to be able to say, yes, we're wrong. But how do we take the measures to move forward? And when it comes to my portfolio, those recommendations are squarely inscribed in the Murder of Missing Indigenous Women's report. I suspect there will be a lot of conversations. This will take tough leadership within the RCMP. But I think indeed most officers will welcome it.
Since the last press conference, there have been, and when you spoke out about, I guess, what you've seen in terms of the RCMP's actions, there have been other cases. How are you feeling now about what you've seen and what stands out to you that you're concerned about?
Well, I'm concerned on a number of levels. There are, first and foremost, this isn't new. It's not new. We've seen a dangerous repeating pattern over the last 3 weeks. I'm someone who believes in independent investigations. They truly need to be independent and they need to investigate the facts. The facts that I've seen are alarming. The facts that every Canadian has seen are very alarming. And when we talk about punishing bad behavior, we're talking about, yes, the bad behavior, and people took oaths, they need to respect them. Hard stop. And if they don't want to, there's a door and they can take it. When we talk about systemic racism and the impact on communities, that's another discussion that needs to be had, yes, in the short term, but medium term and long term discussions. We've had them at Cabinet. We need to be able to allow an environment that doesn't reward bad behavior, doesn't turn a blind eye to bad behavior, indeed acknowledges and points out unconscious bias. That means more representation within the forces. When it comes to Indigenous communities on reserve, as I mentioned earlier, more police, policing in the proper way, re-examining what the police do, their various roles that they play. We talk about their roles within the context of wellness checks. We talk about people talk about the militarization of police forces. There are various aspects that can't be fixed overnight, but we need to address them quickly. In terms of the Murder Missing Indigenous Women's report, legislative framework to circumscribe Indigenous policing. It's one of the main important recommendations coming out of the inquiry. Minister Blair has undertaken to move on it. It's in my mandate letter as well as his. These are lessons that we constantly need to reflect on and move on, both in the short term, medium term, and long term. We need to have some serious conversations within government. You have national leaders, Luki Kotir, one of the Inuit leaders, calling it out. Perry Bellegarde, national chief, has called it out. I don't think it's necessarily going to be the most positive conversation, but these are painful conversations that we have to have as a country. I believe that it is a sign of maturity to be able to point out your flaws so that you can move on in a proper way. The parallels that I've seen in Indigenous communities testify to the incredible allyship that the Indigenous communities have with the Black community. Very few have been pointing out their own issues, and the parallels are strikingly similar, but they stand in solidarity with against anti-Black racism. And that's a real testament to allyship. But we can't ignore in Canada that exists within the Indigenous communities. And the outcomes that you see in the penal system, the outcomes you see across society are a result of systemic racism, and we can't hide from it.
Thank you, Minister. We'll now go to Dylan Robertson from the Winnipeg Free Press, and then we'll go back to the phone for 2 last questions.
Hi, I have 2 questions for Dr. Tam about COVID testing, not about antibodies. I'm curious how you feel about randomized testing. As provinces open up, most are only testing suspected cases. Is it a waste of resources to be testing a broader swath of people? It seems like some other countries are doing that.
Yes, so again, together with the other chief medical officers of health, we discussed what is the testing strategy going forwards now that we're sort of coming down the curve on the pandemic at the moment. So again, I think the priority is put on people with symptoms, any symptoms, even mild ones. That is still the priority. But expanding that so that there's more access to people in the population, so that we can jump on the cases, trace contacts, and eliminate any sparks of or chains of transmission. So then we also discuss the testing of people without symptoms. And the priority is still if you think you may have been exposed. So those who are contacts, absolutely in vulnerable settings like long-term care settings, correctional facilities, crowded congregate living or working conditions, those settings where we've seen outbreaks, essentially, you have to have a very low threshold for testing, both not just the symptomatic, but if you detect even one case, to widen the net of testing to include the asymptomatic people. Some people are also unable to tell you if they have symptoms, for example. And also, I think what we have also framed is the testing as part of surveillance and pilot testing in different populations. So I think what you're talking about may fit into that category, where different jurisdictions are looking at testing in community settings. For example, particularly in hotspots, what you've experienced viral transmission is you've seen some of these mobile clinics being set up to offer testing to even people without any symptoms. So that is to widen the net again to see if there's any hidden chains of transmission as well. And I think there's different strategies right now in testing, not just vulnerable settings, but staff who work in them. So repeat testing for those who work in long-term care, for example, and different vulnerable settings is part of some of the testing strategies. What we discussed amongst chief medical officers is the real need to share the data that comes out of some of those testing approaches so that we can all learn from it and see if we need to broaden the net in other areas as well.
And you kind of touched on this, but I'm wondering if you could expand a bit more, Doctor, on the testing specific groups. For example, we've had truck drivers testing positive. I'm not aware of any sort of truck stop testing where we're just testing people in general or at the border. And I'm curious if that's useful or a waste of resources.
I think some of these approaches are actually being actively discussed right now. So different jurisdictions are considering some of these, and we'll probably hear about some of that in the coming weeks as well. As you know, as the cases come down, attention is turning to, well, what methodologies could they have, and maybe focusing on populations that may have increased mixing with different populations. Certainly focusing on looking at reducing any risk from the importation of cases. And so for populations that are coming across the borders, etc., some of these are now being discussed. Some of you may have heard about illnesses that are appearing in the agricultural sector, for example. So there's active discussions, and so how do we now maybe provide that testing more widely, recognizing that some of the workers may not recognize symptoms, may be living in crowded conditions, may also be worried about disclosing their symptoms as well. So I think one of my key messages that we just talked about racism. stigma and discrimination has to be looked at very carefully. So if you were testing certain populations, be sure to ensure that you support different populations, support people who are testing positive. Otherwise, you won't get people coming in for testing. And that's important for essentially doing the work in detecting the cases. So that might be some of the issues that we're dealing with as well now, is making sure that people recognize the importance of testing if you have even mild symptoms, but also do not stigmatize people who test positive, but support them from recovery and provide the right conditions for them to isolate and reduce transmission to others.
Thank you, Doctor. We'll now go to the phone for the last two questions.
Thank you. Merci. The next question, la prochaine question, is from Yasmin Mehdi from Radio Canada. Please go ahead.
Bonjour, Monsieur Miller.
Mr. Miller, over the last few years, we have seen statues fall, colonial statues, etc., in Europe, in the U.S. Do you think it is worthwhile for Canadians to reflect on these things here? For instance, even street names that refer to these types of individuals. So what do you say about that and violence against Indigenous people?
Moi, j'encourage qui que ce soit qui.
I would encourage anyone who's listening to study our history, our Canadian history. It's quite a history. I mean, my father was a history professor at McGill for 45 years. Insofar as I heard what he told me, I learned a bit about our history. McGill itself had slaves. I mean, there was slavery in New France at the time. We shouldn't deny this. It's undeniable. The issue of monuments, statues, that's an interesting discussion. I'm not sure how I feel about that yet. I think we should further draw attention to these statues and see what they represent. In many cases, when you look at statues in the downtown core of Montreal, these were not erected when these people came to the country. It was done several years later to create a sense of a nationhood. There's a mythical component to this. When we have to when we think about re-examining our myths, the history of Canada, looking at the experience of an Indigenous person who is standing there in front of this type of a statue, when you know that Indigenous people are facing such violence, this type of thing exists everywhere. I would encourage everyone to know the history of this country, especially this month. It's Indigenous History Month. It's important to read books about this, so they will open your eyes to things. I won't take a position as to whether or not these statues should disappear, but I would urge people to really examine what these statues represent. It's important to do that, as I said in English. It's an issue, it's really a matter of maturity, and it's important to question oneself. Sorry for this philosophical answer to your question. That's my answer.
I believe in the reporter asked me a question about what we're doing with statues. And I represent downtown Montreal, which is one of the oldest parts of Canada, in terms of people that came here, obviously. It has a number of statues. The John A. Macdonald statue is often covered in various shades of paint. He's one of the founding prime ministers of Canada. I'm thinking about it. My dad was a history prof at McGill for 45 years. McGill himself was a slave owner. Slavery existed in Canada. It existed in New France. We can't deny it. We can't escape from it. I look at the different statues that exist in my riding, and they weren't put up when people arrived, but they glorified people that arrived in a certain way. And certain people glorified those people as a part of nation building that left people behind, and notably Indigenous peoples. When a lot of issues have been raised with respect to plaques around Montreal that glorify the shooting of Iroquois chiefs. You can imagine how that would offend people. There are statues that depict it. Do I believe in ripping them down? I believe in educating, and I believe in examining our history, criticizing it, re-examining it. I think the highest compliment my dad ever paid for me, he's a very reserved person, was I wish I could go back and teach Canadian history the way I'm learning it now. And he taught it for 45 years. And for someone to say something like that, no one knows my dad, but for someone to say that is sobering, because we always have to re-examine our history, educate ourselves. If we're blind to the past, we're blind to the future.
Thank you, Minister. On va retourner au téléphone pour le suivi.
Back over the phone for the follow-up. Second question is for Madame Joly regarding the $14 billion announced to support provinces. The Prime Minister again today said that it wouldn't be a blank check. Why is your government so focused on targeted transfers? Why not simply hand over the money to the provinces so they can manage their funds themselves? Answer: the government's objective at this point is to help the provinces and territories and municipalities restart the economy. So in an attempt to ensure cooperation, collaboration, the Prime Minister has been speaking weekly with the premiers of the provinces and territories, and we've wanted to present a serious offer that is also based on conditions that will allow for a safe restart of the economy, whether we're talking about access to PPE, whether we're talking about sufficient tests available, whether we're talking about support for daycares, childcare. And to support our municipalities, we know that the provinces and territories have specific needs in the context of helping them reopen their economies, create jobs. We have put that offer on the question. The negotiations are ongoing, and I think it's for the benefit of everyone in the country. Thank you, Minister. One final question.
The next question, la prochaine question est de Julie Marceau de Radio-Canada. À vous la parole.
Radio-Canada. Yes. Thank you for giving me this opportunity. Mr. Miller, Madame Joly, both of you if possible. Mr. Miller, you had strong words to say. You've verbalized the existence of systemic racism at all levels of government and civil life. You said that it was up to provinces and territories to look back at their colonial practices. If that's important, it's important to do that. What do you say to provinces that are not doing that currently? Answer. Thank you, Julie, for your question. I have an issue with speaking publicly to denounce individuals. Sometimes it doesn't serve the purpose intended. People within provincial bureaucracies, of course, have to look at their views about systemic racism. As I said, Senator Sinclair has a good definition of systemic racism. It's basically what's left over once you've dealt with overt racism. It's basically something that is institutionalized within our systems. Is it within the democratic system in our provinces and territories? We're constantly noting this in these underrepresentation of ethnic communities in some institutions. In my own province, for instance, really examining these issues doesn't mean I'm pointing anyone out specifically, accusing anyone of anything. It's really a job. It's an awareness-raising job. And I think that's what's disappointing people who want change to happen overnight. It's that awareness raising takes time. People are sensitive to these issues because they feel targeted. And what we've seen through the demonstrations in Quebec, I can speak for Quebec because it's the province I know best, is that young people are at the front lines in making us aware of what's going on. They're actually encouraging us to question our views. Even people who feel quite confident that they have a clear picture of systemic racism. I think we can say that young people are telling us certain things. My idea is that one day this will come to the fore. It's important to have a debate. We're a pluralistic, democratic society. It's important to be able to express our views. Let's do that. And let's move forward together as a society. Thank you, Minister Miller. A follow-up question? Minister Joly. Last Sunday, I took part in the march in Montreal with colleagues, including Emmanuel Dubois. I think the idea of the fact of being there in person shows, sends this message that we're there, that we're listening. The issue of racism is being discussed with the country, not only being discussed, it's a priority around a kitchen table and within our families. This is a movement that is happening, and we have to realize this. Not only realize it, but also we need to act. And now, as a Minister for Economic Development, I want to say this. I'm fully aware of the fact that as a minister responsible for maintaining jobs in a difficult economy and even creating jobs, everything hinges on the fact that people from various communities need to have access to opportunities, and that is at the very heart of the issue as to what choices they have, what choices their children have. It's certainly one of the priorities within my mandate while I am responsible for regional economic development. What we're noting today is that the economy is being affected by this crisis. It affects the western parts of the country also, but it also affects big cities, Montreal, Toronto. And we know what's happening in Montreal with the pandemic. So we want to be there. At this point, businesses owned by people of various communities, these small businesses owned by people from various communities, they depend on this support. We do this on a daily basis. We want to make sure that they can survive this crisis. We know that access to financing, to banks is harder for members of some communities. So we're here to try in our own way to improve the system, to further opportunities, and so that the issue of racism or the lack of opportunity can be countered by our support. Thank you, Minister. Last follow-up? Yes, Minister Miller. When you say we have to go over these policies, we're in a federation. How do you think you can work through these policies, this legislation, if people can't even agree on the term systemic racism? You are prepared to name it. Quebec is not. I'm wondering how we can do this in a consistent way if you're not on the same wavelength as Quebec, for instance. Answer. Julie, you're asking me a number of questions under the guise of one question. The definition is important. I came up with one earlier on. Perhaps that's not the most important thing. The important thing is to look at what the effect is. The effect of things on Black and Indigenous communities, ethnic communities are dealing with this daily, whether we're talking about hiring, under-hiring, prejudice, things that I don't feel myself, the effect on mental health, on the socioeconomic conditions of these individuals. I think it's important to note that. Quebec has also noted that. You mentioned Quebec. it's the start of a solution. We need to always ensure good communication in a federation. It involves cooperation. The main issue is to make sure, perhaps not out overtly in the public, but among politicians, I think we have a duty to pursue this dialogue. And sometimes it's a clash of ideas, and like any responsible adult, you have to talk to one another. I'm very optimistic. It's very difficult to update our policies. It requires cooperation among members of civil society, especially in my case, given my role as a minister, the work that has to be done with Indigenous groups. I think the result is always positive. Specifically, recently, I really believe in dialogue. When you look at the barricades that basically shut down the economy, really, by having an open dialogue, Mathieu, we were able to move forward. And this is something might not have happened 30 years ago. I think we should all be proud of that. Thank you. Thank you, Minister. That is the end of our press conference for today. Thank you.